Have you ever wondered about the difference between holistic and conventional medicine? We've got an expert who will break it all down for you. And later, are your standards too high? I'm here to tell you that settling is never the answer. So let's go, party's over, my friends. Externally, I wanted to look a certain way, but internally, I wasn't happy. I've had so many procedures, so many treatments, more than I can count. I started to really focus on doing things for my body that made me feel good. I decided to write my book to share this knowledge, and people have really resonated with it. And that night at 5 in the morning, there's a girl at the front door. I was able to figure out what a narcissist was because I was married to a narcissist.
There's some stuff in there I'm very surprised that you're talking about.
I can spot the red flags now from a mile away. I want the viewers of my show to walk away feeling great about themselves and feeling empowered. I'm going to incorporate my story as well in the show, but I also am very interested in learning about other people's stories.
I love your honesty and your genuineness. That's what makes you so authentic and real and why people want to talk to you.
Watch Party's Over. It's going to be fun, informative. We're going to have a great time. Party's over. Welcome to the show. I'm here with my co-host Vita, and we're happy to have Dr. Nadia join us today. The topic is on holistic versus conventional medicine. Hello.
Hi.
Thank you so much for joining us.
Of course.
This is one of my favorite topics.
Mine too, and it's a big one. I feel like it's very nuanced. You can't say that one is better than the other.
Can you tell us what is holistic medicine?
Yeah, so it's a great question. I like to give the example of, in a conventional setting, for example, you have a headache. You go to see your doctor, you've had this headache, this keeps happening. They're gonna give you a medication, right? They're gonna give you maybe a Tylenol, maybe something stronger if a Tylenol hasn't been working, and then that's it. When you are seeing somebody that's more holistic-minded or holistically trained, we're looking at, okay, you have a headache, how do we deal with this right now, but why does this keep happening? Is this coming from a nutrient deficiency? Is this coming from a structural issue, right? Like maybe there's some muscle tension. Is it coming from a food sensitivity in the environment that's creating a headache for you? So we're not just addressing the issue, but we're addressing why that issue is there, and we're taking a broad lens. We're not just focusing on that one symptom.
So when you have a patient come to you, do you start with a battery of tests? And you start with the blood work first?
Yes, exactly. So my husband and I, we have a practice here in Miami, and what we'll usually do is he'll order a list of comprehensive blood work. So when you go, for example, for your yearly physical or with your primary, they're usually running very limited tests, right? And so I always hear patients come back and they're like, oh, everything's normal. Well, yeah, if you're running like 4 things that don't really tell you anything to begin with, right? Like you're not going to see much. So we're running a very extended list. So over 300 different markers typically. And we're not just looking at what's normal or normal and what's out of range, but we're looking at patterns, what's optimal versus not optimal. We're not just waiting for things to become a problem before we address them.
So Nadia is very special for me because she actually saved me when the traditional hospital could not help me. So a few years ago, I contracted dengue fever, which is very unusual in Miami. I was one of 9 cases out of 2.5 million people.
What are the odds?
What are the odds?
Seriously?
I literally should be playing the lottery. However, I went to the hospital. I didn't know that I had been bitten. I just knew that I was really sick. And this went on for like a week. The symptoms were really bad. Started with like 100.39 fever, and it was going up and down, then the rash, and I was having a hard time breathing. I was vomiting. I had no idea what was going on. So I went to the hospital and they ran a bunch of tests, never told me they were even offering a dengue test. It was just my organs were bad, like liver function, everything was bad. And then they released me. So it was just one visit to the emergency room. They run 15 tests, they take so much blood, and then they send me home, and I had no idea what was going on because I was having such a hard time breathing and just everything. So I go home. I call Nadia, I'm really upset, and she goes into my portal and looks at all of the tests that they had done and noticed that, I don't know if you remember, the liver and everything was really bad.
Yeah, and so that's when, because then my husband, he has a background in working in the hospitals and urgent care, so he was like, this is not normal, this is not okay.
So after the visit to the ER, I went home. They had given me some of the test results, but not all. And then a week later, I got a phone call from the hospital, and they said, oh, we're sending specialists to your house for mosquitoes to check your yard. And I thought, okay, why? And then they said, oh, you have dengue fever. And I was like, what's dengue fever? I don't understand. So then they explained it, and then I called you and gave you that
Yeah,
little bit of
that and
information.
then that to us made so much more sense when we saw all of the other liver function tests. Yeah.
Some people are confused about the difference between integrative and holistic medicine. Could you clarify and explain to us the difference?
Yeah, so I feel like holistic is, like we mentioned, taking that broad view, kind of zooming out. And I feel like holistic generally is integrative, but integrative is not necessarily holistic. So integrative will combine different therapies, but it doesn't necessarily take that zoomed out holistic view.
I didn't even know the difference. Did you know the difference, Vita?
I had no idea. I literally
I thought it
thought,
was the same.
There's a lot of, like, I feel like people interchange naturopathic and homeopathy, and they're like, oh, you're homeopathic. I'm like, no.
Is holistic the same as functional?
It can be, yes.
Okay.
Yes. I mean, we could get into the weeds on that, but functional, in my opinion, is essentially naturopathic. And the founder of functional actually went to a naturopathic college and made copies of all of the naturopathic textbooks, and that's where functional medicine came from.
Wow, I didn't know the difference. Did you?
Functional and naturopathic, I would say, a lot more similar.
Okay.
Functional medicine had better branding. They had better marketing, so they're more known than naturopathic. But that's essentially what we do. We get to the root cause.
But it's the same degree. It's the same education.
No,
Oh, it's totally different.
It's the approach that's
Okay,
the same.
I see.
Yes.
do you think there's room for both?
Conventional and holistic.
Yes.
Yes, absolutely.
Okay.
So my husband, he's a conventionally trained MD. And so when we, first started dating, that we were in school, and my background is in naturopathic, and we would, bump heads a lot. But we've both come to this place to see where there's absolutely a place for both, like especially in an acute situation, emergency situation, Western or conventional medicine, I think, really shines. Like, for example, like you being in the hospital with dengue, like the things that you needed in that moment were absolutely necessary, but to help you recover in the long term so that you didn't have a more chronic issue, then that's where like the naturopathic, the holistic, the functional comes into play. So yeah, there's absolutely a place for both.
What would you suggest if somebody was diagnosed with, let's say, stage 2 cancer, and they came to you and said, is it better for me to take a more holistic approach to cure this, or should I go the conventional way of chemotherapy?
That's
know it's a tricky
that's
si- I know it's a tricky
that's very
Way
tricky.
to lay it on that. Goodness.
Yeah, that's. I would say in a case like that, a very integrated approach. So you can use the holistic, but you also want to integrate like whatever is needed at that point. The conventional oncology care. It really there's so many factors. I don't think that it's wise to only go one route, because you can be limiting yourself. And the type of cancer, how fast it's spreading, your genetic predisposition to those kinds of cancers, like there's so much that plays a role. So again, they both can have their place. So I can give you an example from a personal standpoint. My whole pregnancy, the whole plan was to do a home birth, natural water birth, and I did. I had a midwife. And my whole pregnancy was fine. At the time of the birth, dilated, all great, but then the labor started to stall, and after 24 hours of the membrane or like the water being broken, like you're at increased risk for infection. So once that point hit, I had to make a decision, and I went to the hospital, and I ended up having a C-section, and I'm very, very grateful that I did that. So I think, you can't be completely closed off, because you can put yourself in danger. In that situation, I could have put my child in danger, but they both. I really wanted to go that route, but I couldn't have been that stubborn.
I have a question. That's
Yeah.
probably going to sound really dumb, but I can't imagine doing childbirth. Do they give you drugs at a home birth?
No.
I don't know.
I can't even fathom
that's
not
but
giving
that's
birth
the-
without
that's-
drugs. Did you get the drugs?
I was in the
Yes, it
hospital
was
and
I,
didn't
but I
have the
was
drugs.
wondering, like, I mean,
But she didn't have the drugs in the hospital.
I didn't have the drugs, but that was a whole different.
You
I mean,
didn't have
my
them.
pregnancy and delivery was a complete shit show. So mine, the epidural didn't work. I wanted them, but it didn't work. So
yeah.
I basically had a natural childbirth at 18 hours of pure
I
hell.
can't fathom not doing the drugs at birth. That's why I asked, because in my head, I'm like,
No, she wouldn't have had the drugs.
So you didn't want the drugs?
Well, after I got to the hospital, like,
like going into it while you were pregnant.
I
you were
mean,
like, I don't.
that was a conscious decision.
No, she
I
had
made.
high hopes.
Yeah, and the idea is when you're going in the process and as it's naturally well, as it's naturally like happening, your body is producing the hormones and everything that you need so that you can manage it a little bit better. I mean, it's still really painful, but
yeah,
the
yeah,
idea
for
is
them
when you're
very
getting
early.
induced, you're then at that point, like everything's happening in a much more accelerated, unnatural pace. So it's a lot more painful in that scenario, right?
So when your contractions started, and this was your first baby, so you didn't know what to expect, they're painful.
It was so painful.
So then looking back, if you had your choice again, would you have picked going to the hospital?
If it was gonna go according to plan, I still would have gone that
You still
route.
would have gone the
Now,
holistic
going the route, or having the experience that I did, I'll probably schedule a C-section.
Right.
But for me, it was an anatomy issue. So again, we go back to there's a time and a place.
So
for
you would have
conventional
accepted the
medicine.
pain and gone through the pain to have the natural childbirth.
I mean, if everything was going, because everything was going smoothly until it wasn't.
Yeah,
right.
Well,
So.
No.
I mean, I ended up with a natural childbirth, but no,
But not
I mean,
on purpose.
My second child's adopted. Like I was never going, never, ever.
I didn't have a second child for a reason.
going through that again.
I should say that. Like,
It is absolutely the worst pain that you will ever experience in your life, and anybody that tells you any different is lying.
No, I can't
because
even
it's the
fathom
worst
it.
pain you will never experience. Besides maybe a gunshot wound or I had a kidney stone. That was pretty painful. That was just as bad.
Yeah, and in the hospital they were like, "Oh, we can induce you, and you can just push for another hour." I was like, "Absolutely not! Like you're gonna induce? I'm already in so much pain. No."
Right.
So
So then you opted
logging
for the
everything?
C-section?
Like, were you like logging how? Like, so I was a crazy person. I had this thing in my notes where every time I had a contraction, I put it in my notes by like the second.
Did I say that you were crazy?
Yeah, and I took it to the hospital, and I was like, "Look, here's my contractions."
Vita, I know that your father had passed away from cancer, so you have the experience with him receiving chemotherapy, which did not go well. Can you explain?
Absolutely.
What happened?
And so my dad had lung cancer, and what happened was he got fluid in his lungs from the chemo. So what killed him essentially wasn't the cancer, it was drowning from those fluids. That said, I will say this. Before I was a parent, I always said I would never do chemo. Now that I have a child, like a young child, I would absolutely do the chemo. I would, because I think that you have to take whatever you can get, right? I think do the chemo, but also do the holistic approach. Like do everything you can to get rid of this thing, right? But I think there are people that are traumatized by experiences like that and seeing that, and they get scared and they don't want to go the conventional route.
I think you're right, and I think like you said, like if you're going to go that chemo route, then do the things to build your body up so that your body can withstand the effects of the chemo.
Yes.
Right?
Right, that's the difference.
Times have changed. I
Times
feel
have
like
changed.
now that chemo's not the same as it used to be, right? I mean, they give you different cocktails beforehand to make it, right?
I mean,
correct me if I'm wrong.
it really depends
Yeah,
on the
it just depends
cancer.
on the cancer, yeah.
But
And it's
yeah, you can
horrible.
support the body before and after.
In the end, the takeaway would be to have a happy balance between conventional and holistic medicine.
Yeah, I would say so. And just doing what works for you, doing the best you can to support your body. So cutting out, ultra processed foods, cutting out sodas, cutting out sugar, incorporating a lot more of that, your vegetables, your fresh fruits, your meats, to, in moderation and exercising, moving. All of that really counts. All of it counts.
Well, this was great. Thank you so much for joining us today. If you like what you're hearing, share it with your friends. Subscribe and stay in the loop. You'll get new episodes the minute they drop and keep our community growing. Standards are not the problem. Settling is. Okay, let's shift gears. We've talked about healing the body, but what about getting over the difference between control and being controlled? Spoiler alert, he's not confused, he's controlling. Let's talk about standards. Why do we feel guilty for holding them, especially in relationships? Here we explore how standards connect to self-love and why settling is never the answer.
I feel like you have a lot to say about this. Where do we begin?
Where do we begin?
I don't think did you settle at first though?
I didn't settle at first. So I got married in 1999, and my standards, I believe, were very high. I wanted a specific type of marriage, type of life. My ex and I had started a business together. We had kids together. We had the same dream to build this company, have a great family life, and have our kids. He wanted, when we met, the first night he met me, he said we would have cute kids together, which we did. We did. Very cute kids. We had 2. He told me the first night he met me that he wanted 3. And so 2 kids later, everything was great. And then in 2009, that's when things started to shift. So in the beginning, I would say my standards were very high. And then over time, they depleted.
Like majorly? So what happened in 2009?
So in 2009, I noticed a shift where he said, or actually not said, he just stopped being intimate with me. And over time, he would just say, well, I'm just not sexually attracted to you.
Pause really quick. Was it like, did it take a while to stop that? Like, was it like you had intimacy like once a week and then it went to once a month? Or was it just like a halt? Like an aggressive?
I would say it was 3 times a week, and then it started less. And then in 2000, I specifically remember fall of 2009, where we weren't intimate at all. And I remember commenting that, or making a comment to my father, talking to him, and I was like, look, I can't do this. I'm very upset. We're not really being intimate. He said, that's emotional abuse and you need to leave. So now we're at Christmas time, and we went on vacation with the kids. We came back, and after the vacation, I told him that I was going to leave because I wasn't happy, and he said, no, stay, I'll do better. And then my father passed away. So when he passed away, I just didn't even think about leaving at that point. I was so upset, I was so depressed that I just stayed.
You settled.
I settled.
Basically.
I basically settled.
Your standards went from here to here.
For our listeners, do not settle, because that's probably the biggest mistake I made, was accepting that type of behavior in 2009, which as the years went on, I realized he was unfaithful during that time, which I hadn't caught him, so I didn't really know what was going on, but the signs are there. So you know when somebody doesn't want to be intimate with you, or somebody is not paying attention to you the way that they did, or you see behavioral changes, something's wrong.
So that's the first red flag.
And then he got a new group of friends and started traveling nonstop. Okay. So at this point, he got a place in Vegas. He's traveling all around.
So for everybody who doesn't know you, you were in Maryland at this time.
Yes.
You were not in Miami.
No, I was living in Baltimore.
Your
Maryland,
hometown.
My hometown. And he was not around that much, so I'm home with 2 kids. I had no idea what was going on. And to be honest with you, I was scared. I was scared to leave. I was scared of the unknown. I was scared of what kind of people would be around my kids if I had left. I was very protective of my kids, and I wanted to control the situation at my own detriment.
So do you think by trying to control the situation, in your head you probably were thinking you weren't settling, but you actually were? In a weird roundabout way.
I pretty much knew I was settling.
You knew you were settling.
Yeah, I know. I knew this wasn't right.
And then how long did this go on
So
for?
fast forward a few years, then we did a personal development program together, or he did the program and then I followed. Things got better, and then we moved to Miami, and that's when things just really got bad. So, the infidelity was at an all-time high.
Did you catch him red-handed at all?
Yes, numerous times.
What was the worst one? Like, let's let the people hear how bad this really was. Like, everybody, like, people have caught people cheating, but like, let's hear how bad this was. Like, how red-handed was it?
Okay, so we were separated. So I don't know if this really counts, because we were separated in 2000.
No, if I don't know if this really counts, means it counts.
Okay, so in 2016, he wanted to do an in-house separation for 60 days. So we're in the same house, and he's just doing, I guess, whatever he wants. And he didn't this was when photos and videos were going to the iCloud, and I guess he didn't double click the delete. So I'm looking at the computer and I'm seeing videos of him with other people. And I didn't know what was going on. And
Did you like want to throw up? Like
it
what?
was awful. So I'm watching this,
Horrific.
but then I'm like, okay, well, we're not really together right now. So I would say that's catching somebody red-handed.
Yeah.
Then we got back together because now we're living in a place where I had very few friends. So I'm living in Miami. I have no idea what's going on. We just sold our house in Baltimore. So I'm in Miami with my kids in pretty much a strange place and scared.
Yeah.
So then we get back together, we work things out. Fast forward the following year, which this is probably the craziest story that is going to be in my second book. I take the kids to Disney World, and they each had a friend with them. So we're at Halloween Horror Nights, and we're sleeping because it's 5 a.m, and we have a Ring camera on our door. So the Ring camera goes off. My phone rings. The girl's standing at the door, and she's like, "Hi, is David Silverman home?" And I said, "No, I don't know. I mean, yes, he's home, but sleeping." And she's like, "Well, he called for me." So the dogs are barking. He comes down the stairs, and he says, "Oh, who is this? Wrong house." And I'm like, "No, it's not the wrong house. Her name's Naomi, and she asked for you, and it's the right house." And he's like, "No, no, no." And then he looks at her, and he's like, "You're not what I ordered."
I literally can't. How did you not cut his balls off?
I have
like,
no idea.
seriously? I
literally
would have
have
like,
no idea. So I went to
Sorry,
bed. The next day, I wake up. My son's friend looked at me. He's like, "Does Dave have a side chick?" And I was so embarrassed. I'm like, I have no idea what's going on. And at that point, he went into therapy. I just kind of ignored it, which how do you even ignore something like that? Because he said that he was just messing around the night before, and it wasn't real, and somebody came to the house anyhow. So it was a kind of a strange situation. So fast forward. Okay, so for all the listeners, I am settling at this point. I'm settling for years, which I knew better. I know that I shouldn't have done this. And we had another separation in 2023, got back together again for another year, and then he tells me again for the 25th time that he's not happy, he's not sexually attracted to me, and had requests. He's like, "If I stay, I have some requests." So he writes down the requests, and one of them is, "I can do whatever I want and you don't ask questions," which is really somewhat of an open marriage.
Yeah.
So I agree again because I still don't want to break up my family. So I basically gave him a green light,
And then what happened?
and he still left.
I mean,
so he left 2
come on,
months later.
buddy.
So he leaves 2 months later with a green light. So I'm like, this guy has a green light and he's still leaving.
So here's the thing. I feel like husbands are kind of like children and they need boundaries, right? It's like speed limits. So there's like if you set the speed limit at 100 miles an hour, somebody's gonna go 120 miles an hour.
Exactly.
You set Dave's speed limit at like 1,000,000 miles
Yes,
an
I
hour.
gave
So
this
he
man-
went like
Yes.
to 1,000,000 too.
Exactly.
So if you don't have standards, i.e. limits and boundaries, people will just go do whatever the F they want.
Exactly.
Which is what he did.
So
and then
I
it's
had,
never enough.
Yeah. So I had the standards in the beginning, and then somewhere along the way, I lost myself. I lost control over the situation, and I should have left. I should have left in 2009. I didn't leave. That's my issue. And, you know, looking back, I'm happy that I didn't leave just because I don't know what kind of people would have been around my kids. I wanted to protect my kids. But as an adult, and as my kids got older, and they were 21 and 22 years old, or 20 and 21, I should have left.
Imagine
and I
if
still didn't want to break up the family.
Imagine if your daughter came home and was like,
Horrible.
"My boyfriend said this."
I
You'd
would
lose
die.
your mind.
I would
You'd
die.
lose-
I would have never had her accept something like that. So I wasn't the best person with giving somebody standards. I would never do that again. Now I feel like I'm over.
But there's danger in that, right? Like, so this was a really extreme situation. What about these people, like these single girls, right? And they set their standards so high. And they're like aging, they want children, and their standards are like up here.
Which is
And
a
they
major
need to like lower the bar a little bit. So I think that it's a fine line. Like, no, your husband shouldn't be able to go have sex with whoever he wants. That's outrageous. But like, maybe you don't need a billionaire that looks like a movie star, that like has 20 houses, that's gonna treat you like a princess all the time, right? Like, do you think there should be a shift in standards?
I think so, because this is the issue, and you're right. As women get older, they become more confident, their standards are way higher, and a lot of them never find somebody. So I feel like they should lower their standards a little bit. So there is a fine line. I mean, you shouldn't be like me, who had no standards, but you should have some standards.
Yeah, I feel like you should definitely be open to people, and like maybe your standards shift. Like what I wanted in my 20s now as a 40-something mom isn't what I want. Like, you know, in my 20s, like I wanted Mr. Bottle service. Like I don't want that right now, you know? Like I want like a stable person. Yes. So I think that your standards shift with age, but I also feel like these women just get caught up with these like boxes they need to check. And there's a difference between that and having standards and self-worth.
Every single woman that I talk to has a lot of boxes to check.
Too many.
I feel like it's too much, and they should lower their standards, not have so many. I mean, now at 54, the person that I would like to meet is just a really nice person, good family values, good morals. Hopefully,
nice goes a
never
long
cheated on their
way.
wives.
Nice and loyal. That's all you need. Like the other stuff you can figure out, right?
Exactly.
I mean, yeah, like the other stuff helps a little bit, but you know,
But it's
overall, like you can't have a relationship without those ways. So I feel like these women need to find some sort of baseline, right? Like non-negotiables, but then maybe shift from that, right?
A little bit. Yes.
It's like, here's my non-negotiables. I need X, Y, and Z, right? But I'm willing to waver a little bit on others.
And you really need to give people an opportunity and give them a chance, because I meet people all the time and I feel like sometimes I'm not giving them enough of an opportunity to see who they really are, because you know, it's easy for us to have all these preconceived notions and judge somebody without really knowing them. So I feel like you need to give people maybe a little bit
But
longer,
not too many chances.
No, more of a chance to get to know who they are, because not everybody puts their best foot forward
100%,
right away.
or they could be nervous, or
Yes.
you know, I don't always put my best foot forward. I mean, maybe I do. I don't know. I'm good at faking it, but everybody might not be.
That's true.
It's tough though. It's really tough. Like, what would you tell Zara, like your daughter?
I would
like,
tell my daughter to have way higher standards than what I did. She's young, she's 21 years old, and she has a lot of time.
So outside of just like, you know, those types of relationships, I think people need to look at standards in their everyday life, like female friendships.
Exactly.
Huge place people lose their standards. As
do.
grown women, you deal with abuse from your friends. I feel like that you, or your so-called friends, that you wouldn't deal with from a spouse or like a boyfriend
Absolutely.
or something.
And you and I have both been in those situations
Yeah,
with
it's
friends.
horrible.
You and I both ended friendships that we've been friends with these girls since college.
And I think that's a part of aging, right? Like you reach a point in your life where you're like, I'm not gonna deal with this nonsense anymore. Like, my friendships shouldn't be taking more energy than the actual stressors in my life. Like your friendships are supposed to make you happy.
And I shouldn't be running away from dinners with friends.
Literally, or like leaving dinners in a panic.
Okay, so Vita, I'll just tell a quick story. So Vita and I are in Baltimore. She's at a dinner downstairs.
Separate dinner, having nothing to do with
She's
this
at a dinner
dinner.
downstairs.
I think I was pregnant.
I don't
Yeah.
remember if you're, yes, you were
Yeah, I
pregnant.
was pregnant. I was like-
So she was downstairs having dinner with friends. I was upstairs having dinner with my college friends. We were friends for 35 years.
The foursome.
It was a foursome.
Fabulous foursome.
Fabulous foursome. And one of the foursome had a problem with two of us. And she
Jealousy.
was always jealous, always having issues with us. Every time we got together, she would sit and talk about what we did wrong and how bad we are. And I don't know what came over me, but I texted Vita and I was like, I'm coming to your dinner because I can't do this anymore. So I literally, two of us got up, ran away from the dinner, went downstairs, sat with Vita, and that was the end of the friendship. So,
Have you guys talked at all?
no. So the foursome is no longer a foursome.
twosome
It's a twosome now. So it's a twosome on both sides. So you have
Oh wait, they're friends still?
two together, and Sue and I are together. So.
Oh, interesting. I never realized this.
And Vita had a very similar
Oh my God,
foursome situation.
I've had foursomes and like threesomes, and I think, and it's so ridiculous, but I think that what happens is as you age, people go in different directions in life. And I think that there's two types of people. I think there's people that want the best for their friends and could care less if their friends have more. And I think there's people that sadly want the opposite. Like they're the misery loves company camp. Like I want my friends to do great. Right.
And if they're not your cheerleader, you have to walk away.
100% you have to
100%.
walk away from that.
If they're not helping you in life and they're not making deposits and they're just making withdrawals from your life, that's not a friendship. So you really need to reconsider and have high standards for your friends
Energy
as well.
suckers. And it's like they don't want good for you, which is so pathetic. Like, I mean, how pathetic are you that like you don't want good for your friends? Like, come on.
But it happens all the time.
Especially with women. Like, I feel like guys don't have this problem. Like, you don't see guys like
Not as bad.
They get a little competitive, maybe. Like, one starts making more money than the other, but it's not like this like cat-bitey. Like, can't handle it. You know?
Yeah,
And they
not as
walk
bad.
away differently.
They do walk away differently.
Like guys can just like have a falling out and not even know they had a falling out.
But even if
Girls, you know you have.
And the other issue is, like when we started in college, everybody's pretty much on the same playing field.
Yes.
And then everybody grows in different directions. And like you said, some people are more successful than others. And
Some
if-
people take care of themselves better
More than others.
Big hot button.
And but it's not the same anymore when you fast forward 20, 30 years. And if those people can't grow with you, then you have to cut them.
I completely agree. Just snip, snap.
That's right. The biggest takeaway here is that you have to choose you.
And you're worthy.
100%. And now let's hear it from you. This is Spill It, where we answer your real questions. Nothing's off limits. So here's one we just got, the gossip. Sandy, I think one of my friends is super jealous. She tells people about procedures I'm thinking about doing and haven't even begun. What's the deal with this? I tried pulling away, but that just made her talk about me more. Do I ignore it, talk about it, or cut her off completely? How do you deal with someone who thrives on gossip?
Ugh. Tell them that you're not friends with them. No, but like really, almost just end the friendship, right?
End the friendship, but also maybe have one conversation. I feel like if it's a long friendship, have one conversation with the person, tell them your concerns and tell them how you feel, and then see their response or their behavior after.
I feel like this is the thing with gossip. People who come to you with gossip are likely gossiping about you to somebody else,
That's true.
right? They're just gossipy assholes.
That's
And
true.
that means that they're insecure in themselves,
Yes.
really. Because why are you spending all your time worrying about somebody else? Like, I don't have time to talk about it.
And a real friend isn't gonna talk about you behind your
No,
back.
and they're not gonna make things up.
No.
So I think this is one of those things where you have standards and you say, if you want to be friends with me, you cannot be talking about me.
So you give them one opportunity.
One.
That's it.
But not 10.
No, not 10. You give them one opportunity to make changes, and if they can't make the changes, then you cut them.
Snip, snap.
That's it. Share the show with your friends and drop a review. Don't forget to grab my book, From Bullshit to Botox, and follow me at Sandra Lena Silverman on Instagram for behind the scenes, real talk, and beauty tips that actually work. You don't need to lower your standards. You need to stop negotiating your worth, protect your peace, protect your energy, and never apologize for doing so. See you next time.